Welcome back. Save your teeth. May is Save Your Teeth Month, but it is so important to protect your teeth and prioritize your oral health year-round. Sometimes, though, we may not know the best jumping-off point on where to start in taking care of our oral health. So, to help us out, we are joined this morning by Dr. Stefan Zweig. He is an endodontist who is here to share tips to avoid dental emergencies, plus what to do if you're already experiencing pain or cracked teeth. Doctor, good morning. Thank you for being here.
Good morning.
So, teeth, these are so important to take care of all the time. We brush, we floss, but there could be some more that we need to do in prioritizing our oral health. But let's kind of start with the basics here. What is the difference between an endodontist and a general dentist? And when do you know you need an endodontist?
So an endodontist is a dentist who's received a minimum of 2, even 3 years of advanced training in the diagnosis of dental pain, in the performance of root canal, and helping patients save their natural teeth. So many times when you have pain, you may require root canal, and that's what endodontists specialize in. So if you have pain, you can either go to your general dentist, who may send you to an endodontist, but also you can actually refer yourself to an endodontist who can help you deal with that pain. We're seeing a lot more patients who are understanding that endodontists are specialists in treating dental pain and who are referring themselves to endodontists for their treatment.
Just going straight to the source to take care of mouth pain. That is the worst. Anyone who has suffered through mouth pain understands that it is debilitating and you cannot get away from it. So what should you do if you have a cracked tooth or mouth pain in general? What's that first step to taking care of it?
Well, I mean, the first step is prevention. So if you see a dentist frequently, at least twice a year, that dentist will probably give you a thorough examination. And a lot of cracked teeth can be detected before they actually become major problems. So that is the first step, is to see a dental professional twice a year to have professional cleanings and checkup. That being said, cracked teeth can happen at any time, and as a matter of fact, we're seeing sort of an epidemic of cracked teeth over the last 20 to 30 years, and in particular in the last 2 years, when patients have been unable to see their dentist because of the pandemic and because they're under a tremendous amount of stress and are grinding their teeth and having other issues that are actually predispose you to having a cracked tooth. So when you have a cracked tooth, the first thing that you need to realize is that you don't necessarily have to lose your tooth when your tooth is cracked. There are procedures that can be done to save your tooth. So you may want to visit your dentist first. But many cracked teeth present with pain. And pain usually means that you need a root canal. So if you have pain after having a cracked tooth, you should go to an endodontist to have that evaluated, who can do the root canal and may refer you to a general dentist after that to restore the tooth, maybe put a crown on it.
Absolutely. I like what you were saying about saving your tooth. You don't have to completely lose the tooth. There are ways to save your natural tooth. So that kind of segues into my next question of, why do endodontists support saving your natural teeth?
Well, you know, there really is no replacement for your natural tooth. When you lose a tooth, it becomes, you know, it's a devastating life event for some people. It affects the way you chew and eat. It can even affect you in other ways that you don't even realize. So it can affect your aesthetics, the way you look, which could affect the way you relate to other people. It can also, you know, affect your job performance. So it's really, you know, to your advantage to save your tooth. If you decide not to save your tooth, then you have tooth loss, and tooth loss requires tooth replacement. And the alternative for replacing a lost tooth can be very costly, it can be very complicated, and often a very drawn-out procedure, which can be, which is not easy. So if you can save your tooth, you're that far much ahead of the game. And we really feel that saving your natural tooth, if possible, is really the best way to go.
Absolutely. I kind of want to circle back to what we talked about a little bit earlier about preventative care and just making sure you take care of it before it could even be a problem. What preventative care, what are other sorts of preventative care people can do to avoid a dental emergency of any kind?
Well, it really starts at home. So basically, you have to brush your teeth 3 times a day and floss your teeth. But we tell people that, no pain is normal. So even if you have minor pain in your mouth, it could be an indicator of something that's actually becoming more progressed. And so you want to try to see a dentist immediately, because you may be able to avoid treatment by catching things a little bit earlier. But, be aware of your own oral health and see your dentist regularly, because you're going to get checkups and they're going to be able to catch things that are early in early stages and may prevent further treatment.
That's fantastic. Listen to yourself, your mouth, your body. Listen for those signs of pain and everything like that. Finally, to wrap things out here, where can we go to get more information about root canal treatment and to find our own endodontist nearby?
Sure. So the American Association of Endodontists has a website, and it's findmyendodontist.com. And on that website, you're going to find a lot of information about root canal. You're going to find out what endodontists do and the ways that they can treat you to save your tooth. And you're also going to find a search function where you can actually put in your location and your information and find an endodontist near you. So again, that's findmyendodontist.com. They'll help you find one near you.
Wonderful. Making it easy for us. We really, really appreciate it. Thank you so much for being with us this morning.
Thanks for having me.
All right, for a full recap of everything we just discussed and ways to protect your teeth, head on over to our website, nmliving.com. Stay with us. We'll be right back.